in the KUAM News Zoom room. And she's probably grabbing some empanada or frittata.
Yeah.
Good morning, Lillian.
Good morning.
Nice jacket.
Good morning. Good morning. I'm sorry I'm running late, but
No problem.
just other things just keep coming up.
I'm sure. I know your time's very limited, so if we could, you want to just jump into our COVID update here at the Guam Memorial Hospital. Administrator Lillian Posadas.
Okay. Well, good morning. Good morning, Chris. Good morning, Bree.
Morning,
good morning, Jason. Guam. Good morning, everybody. Our census this morning is at 77, so it's kind of come down. And of course, we have had 4 COVID-related fatalities, and so sad news. 4 within 24 hours. And that's really
so there was
sad.
another.
Yeah. When did the latest one occur?
The latest one, a little bit after midnight last night, and I'm sorry, but I guess the JIC hasn't put it out yet, perhaps, because other things are going on. But we did have a 4th one a little after midnight last night.
Do you know the age and any other details about that death, Lillian?
It was a male individual in his 80s.
How long had he been at GMH? Was there comorbidities?
Yeah, I believe it was admitted early part of this month. Perhaps maybe the 1st of November was when he came in.
And you said comorbidities? Comorbidity?
Yes. Yeah, he has some comorbidities, some underlying health conditions, yes. And so, again, our condolences and our prayers to the family.
And so 77 hospitalized at the Guam Memorial Hospital. How many receiving ICU level of care?
12 of them are at the ICU level of care, and of the 12, 6 of them are on ventilator support. And then at the SIF up in Barragata Heights, there are 12 individuals there.
Lillian, do you have an exact age for the 85th fatality? I know you said 80s.
Yeah, he's in his early 80s.
Okay.
84.
84.
Correct.
Any new Blue Med tents that have gone up? I know you talked about the one.
Yes, we are using the Blue Med 10 as a fast track, overflow from ER. And so, it's assuring for the physicians and the nurses that they have, an option to, if in case again, the ER is saturated, with patients waiting to be treated, waiting to be either admitted or discharged home. So we have that option. We have that capability now available in an enclosed, medical tent that has the negative air pressure.
Did you guys receive the Regeneron shipment?
Not yet. We haven't received it. We haven't even heard that it has already then been given the EUA authorization. I mean, we were told last week that it was probably going to be coming in 7 days, but we haven't have an update that it is on its way or that it has, received the emergency use authorization.
Have you been participating in any of these discussions about the opening of a possible COVID clinic?
Well, and that's something that we would like. I've talked about it and I've heard others discuss it. It will be great. It would really be helpful that, the clinics out in the community can open up some days for individuals to be seen and to be given guidance and assistance and support, before they start manifesting serious symptoms or acute symptoms, so catch it before they get to that stage, then they end up needing to be in the hospital for acute care. So if, the clinics can open up their, their clinics, their put hours, have hours available so individuals can, who test positive can be seen and be given that, assistance, that support, or whatever treatment that they can get, that will be a great help.
But
I
no,
haven't heard further discussion if that has already happened or that they're still talking about it.
okay. What about staff? Have you received any new nurses or respiratory therapists from your staffing solutions contract?
Yeah, we have received, was it Monday night, Tuesday night, we received 13 additional staff resources, and it's a combination of registered nurses, respiratory therapists, and certified nursing assistants. And then we received again some, excuse me, some last night. And so, yes, we continue to receive the additional staffing resources, which is really, very helpful. We're anticipating to get next week some additional emergency room nurses, because that's what we haven't received. And, our nurses are in the ER. The ER nurses are just burning out. They're just calling in sick every now and then. And so we need to infuse our emergency room with ER nurses who have COVID experience, working in an ER area.
How many off-island medical professionals, nurses, do you guys currently have working and assisting GMH?
As of yesterday, we have a total of 68. No, actually, no, 78 resources from off-island, from one staffing solution, and then 16 from the other staffing solutions company that we've contracted since 2018. And so total number of registered nurses out of that count, 68 are RNs in the various specialty areas, ICU, hemodialysis, telemetry nurses. Those are the specialized areas that we really need help in. And we've gotten the resources from the staffing solution agencies from off-island. We're requesting to have at least 2 physician intensivists. These are physicians who really specialize in the, particularly for the pulmonary critical care intensivists. Because right now, Dr. Algun is the only pulmonary critical care intensivist in our facility. And, we've been making her work 24/7. And even though we do have some, internal medicine physicians, her specialty is a rare specialty that, just really focuses on the pulmonary system. And that's what this COVID infection, attacks primarily, is the respiratory, the pulmonary system. And so Dr. Algren has been the one that's been our COVID warrior.
Yeah.
Throughout this whole time since March. And so we need to give her some help.
I know one of the things we had talked about in the past was moving, I think you said it was the non-COVID patients over to the SIF. Is that still something you guys are seriously looking at?
Absolutely. We're trying to utilize whatever capacity resources we have. And the issue, though, the challenge that we have with that SIF is the HVAC, the ventilation system. It's one whole system. And so we cannot really mix COVID and non-COVID until we get that resolved. And so we're working with the engineer, the contractor, to separate that ventilation system, so that we minimize whatever cross-contamination through the ventilation, because this virus is airborne. And so therefore we want to make sure that we protect the non-COVID patients from getting, the airborne transmission from those patients who are there who have COVID. So yes, that is still our goal, is to utilize that facility for both COVID and non-COVID. And but we need to make sure we have that safeguard in place.
Is there a projected timeline on when you want to effectuate that?
we've been wanting to effectuate it since last week, but again, we're relying. Yeah,
Since ever
we're-
since.
we're-
True, effectuate our girl.
what's that?
No, Chris just making jokes.
I said, sempre effectuate all, girl.
Yeah, but we're relying on the expertise of the engineer, the contractors to help us, meet that, resolve that issue. So
Okay.
we're hoping we can get that done soon.
Speaking of engineers, the Army Corps of Engineers, I know they completed NAFAC completed their work 10 days ahead of schedule. What, it was a week ago or something like that. Have they started doing the additional work that you were kind of mentioning last week when we spoke?
Well, I think they did the assessment already. They
Okay.
completed the assessment. Just augmenting the electrical circuitry in that area is all that's left to be done. And we're hoping that that's not a complicated task. So yes, we're waiting again for their feedback on that one.
Any more staff? Lillian test positive for the virus since the last time we spoke?
No, knock on wood, we haven't received any new staff, and hopefully that it doesn't happen, because, it just says a lot that people are using the tools and the practice and the protocol to, keep their PPE gear appropriately, putting it on appropriately, and then doffing it off appropriately when they're in those COVID care units.
All right. Thank you, Lillian.
Thank you too. You take care and stay safe.
You too.
You too, Lillian. We have a virtual, basically it's our post-election merienda because I know a lot of people were up and they need to replenish their bodies with the essentials. So we have virtual frittata, virtual chicken,
Okay. Oh my gosh.
yep, virtual chicken a la king. Don't worry, it's low to no fat. It's that virtual.
Okay, it's vegetarian.
Yeah, it's vegan, vegan frittata.
Enjoy it.
Thank you,
All right,
Lillian.
Take care.
Okay, it's that.
Take care. Bye-bye.
All right, Lillian Posadas, so gracious to give her time to us for our COVID